Hey, do you know what is fundamentals of nursing? Today I am going to discuss some of the important questions that can come for your first year GNM examinations. If you are new to the channel, please don't forget to subscribe and press the bell icon so you will not miss any single video. This is Agla, welcome to Nursing Guru. Fundamentals of Nursing question paper includes Fundamentals of Nursing and First Aids. Fundamentals of Nursing. This course is designed to help students develop an ability to meet the basic health needs of the patients with regard to nursing care and develop skills in the competencies required for rendering effective patient care. Next, First Aid. This course is designed to help students develop an understanding of community necessaries and be able to render first aid services as and when need. Next, we will move to the patterns of question paper. The patterns will be meaning the following, true or false, fill in the blanks, short answers and essay. Now we will move to the meaning the following questions. On that first question is first aid. It is the assistance given to any person suffering a sudden illness or injury with care provided to preserve life, prevent the condition from worsening and promote recovery. The next question is hospital. It is an institution providing medical and surgical treatment and nursing care for sick or injured people. The third question is dyspnea, which means difficulty in breathing. The fourth question, which is diuretics. It is also known as water pills, are the medications designed to increase the amount of water and salt expelled from the body as urine. The next question is communicable diseases, which are the infectious diseases transmissible by direct contact with an affected individual or the individual's discharges or by indirect means. The next question is splint. It is a device used for support or immunization of the limb or the spine. In addition to that, I'll give some more examples like emollient, asphyxia, decubitus ulcer, nursing diagnosis, body mechanisms, health and illness, edema, exercises, hygiene, antibiotics, crisis, vital signs, rehabilitations, health hazards, inhalations, therapeutic environment. Next, we will move to the next pattern of question, that is fill in the blanks. Each question carries 1 mark. First question, deficiency of hemoglobin in the blood. The answer, anemia. The next question, bleeding from nose is known as answer, epistaxis. The next question, dash is a process by which feelings and ideas convey to another. Answer is communication. The next question, dash is stiffness of the body after death. Answer is rigor mortis. The next question, loss of appetite means dash. Answer, anorexia. The next question, bedsore is also known as dash. Answer, decubitus ulcer. Next question, dash instrument is used to examine the stomach. Answer is gastroscopy. Next question, when temperature is high in the morning and low in the evening, it is dash. That is inverse fever. The next question, visual examination of the body is called dash. Answer, inspection. The next question, presence of albumin in the urine is termed as dash. Answer, albuminuria. The next question, decreased respiratory less than 10 breaths per minute is called dash. Answer, bradypnea. The next question, specific gravity of urine is dash. Answer, 1.001 to 1.030. The next question, inability to sleep is called dash. Answer, insomnia. Next, we will move to the another pattern of question, that is true or false. These questions also carry 1 mark. On that first question, random specimens are collected only at one time. The answer false. The next question, knee chest position is used to examine rectum. Answer true. The next question, heat regulation center is hypothalamus. Answer true. The next question, drugs used to stop vomiting are called antidiuretics. The answer false. The next question, hospital acute infection is known as nosocomial infection. Answer is true. The next question, dyspnea means difficulty in swallowing. Answer false. Next question, the presence of blood in the urine is called hematuria. The answer is true. The next question, hospital acute infection is known as droplet infection. Answer false. Next question, laryngoscope is used to examine the larynx. Answer true. Next, temperature of the water for sitz bath is 110 to 115 degree Fahrenheit. Answer false. The next question, thumb should not be used for count the pulse. Answer true. The next question, prevention of bedsore is not the responsibility of the nurse. Answer false. Now we will move to the next pattern of question, that is short answers. I'll give some of the examples of short answer type questions. Don't forget to work on it. First question, it is sterilization technique. The second question, role of a nurse in discharge procedure. Third question, nurse's role in maintaining intake and output chart. Next question is crisis. The next question is qualities of a good nurse. Next question, nursing care of a client with decubitus ulcer. Next, interpersonal relationship in nursing. Next question, maintenance of therapeutic environment. Next, comfortable devices and their uses. Next, importance of maintain records. Next question, determinants of health. Next, nursing care of terminally ill patient. Next question, communication. Next question is importance of records and reports. Another question, care of body after death. Next, medical and surgical asepsis. Another one, disinfection techniques. Another one, urine test for sugar and albumin. Next, rules for administration of medication. Another one, first aid in hemorrhage. Next question, routes of administration of medicines. Next question, first aid in care of explosion and earthquakes. Next question is hot and cold application. Next question is principles of applying bandages. And the next question, nurse's responsibility in collection of sputum and urine specimen for culture. The last question, which is first aid in case of critical burns. Next, we are moving to the last section or pattern of question, that is essay type. In this essay type questions, we will having a pattern of A, B or A, B, C type questions. We will move to the first question. A, define health. B, explain about determinants of health. Next, second question is define cross infection. B, list the prevention of cross infection. C, explain about barriers nursing. Third question, A, define feeding. B, discuss the nurse's responsibility in feeding a helpless client orally. Fourth question, A, define bedsore. B, mention the causes of bedsore. C, write the methods of prevention of bedsores. Next question, A, define discharge. B, write the details of discharge procedure of a patient with respiratory problem. The next question, A. Define nursing. B. List the principles applied for nursing procedure. C. Write in details the role of a nurse admitting a patient to the hospital ward. Next question. A. What is assessment of a patient? B. Explain the method of assessment by palpation, auscultation and observation. The next question. A. Define nursing process. B. State the steps of nursing process. C. Explain assessment as a step of nursing process. Next we will move to the another question. A. Define enema. B. Explain the procedure of administration soap and water enema. Next A question is define blood pressure. B. List the factors causing variation in blood pressure. C. Explain the role of a nurse in measuring the BP for an adult patient. The next question is A. List the purpose of steam inhalation. B. Explain the procedure of giving steam inhalation by using Nelson's inhaler. Next question A. What are the various ways by which heat is produced in the body? B. Explain the characteristics of pulse and respiration. C. Write the procedure of recording axilla temperature. Next question. A. Define diarrhea. B. What are the causes and signs and symptoms of diarrhea? C. Write the nursing management for dehydration. Next question. A. Define personal hygiene. B. Explain the role of a nurse in maintaining personal hygiene of a bedridden patient. So, these are some of the repeated questions. If you are working on all the questions, I can make sure that you will get a better score. And one more thing, still you have not downloaded the Nursing Guru app? Download it now. Okay, we will meet you on the next video.